Naturally, the esophagus, the stomach and the duodenum are lined by the mucous membrane, which secretes mucus that serves as a protective barrier and prevent damage that would have been caused by the strong gastric acid which is secreted for digestion. And any compromise to this protective barrier will give rise to irritation, inflammation, and subsequently ulcer. And this is what brings us to the topic of discussion today, which is gastritis and peptic ulcer disease. But the good news is that this ulcer can heal with proper treatment and some dietary changes or modification. If this is the type of content you are interested in, ensure you watch this video to the end. Hello viewers, welcome back to my channel, Ask Your Nurse. If this is the first time of seeing my video, I'm Ashamu Oluwaseun. I'm a registered nurse. This channel focuses on content related to health. Thanks for stopping by, and don't forget to like, subscribe to my channel and hit the notification bell below to be the first person to know anytime I upload another new video. And now, what is gastritis? Gastritis simply means inflammation of the lining of the stomach, and if this gastritis is left untreated, it progresses to ulcer. Now, what is peptic ulcer disease? Peptic ulcer disease is an open wound or sore in the lining of the esophagus or the stomach or the first part of the small intestine, which is the duodenum. And this peptic ulcer disease can be classified into three: the esophageal ulcer, the gastric ulcer, and the duodenal ulcer. Now, what are the causes of gastritis and peptic ulcer disease? What causes gastritis can also cause peptic ulcer disease, because if gastritis is left untreated, it progresses to peptic ulcer disease. The number one cause of peptic ulcer disease is infection by a bacteria called Helicobacter pylori. This bacteria can be gotten from contaminated food, contaminated water, through kissing, and this bacteria destroys the inner lining of the stomach to cause ulcer. Other causes include the prolonged use of drugs like corticosteroid drug and non-steroidal anti-inflammatory drugs like aspirin, diclofenac or ibuprofen. Then any disease condition that leads to increased production of acid in the stomach like Zollinger-Ellison syndrome can cause peptic ulcer disease. There are various predisposing and aggravating factors to this peptic ulcer disease like smoking, alcohol, prolonged hunger, prolonged stress, highly spicy food. All these can aggravate the symptoms of ulcer. So what are the signs and symptoms of peptic ulcer disease? The major sign of peptic ulcer disease is abdominal pain, and this abdominal pain is usually located at the upper part of the abdomen, which may radiate to the back, at the center of the back, and this pain can be aggravated or relieved with eating, depending on the part that is affected. If it is the stomach that is affected, that is the gastric ulcer, you feel more pain immediately you eat. But if it is the duodenum that is affected, you feel relieved after eating, and the pain can start 2 hours after you have eaten. Other signs and symptoms are bloating. You just feel bloated and feel full. You have indigestion, you can have nausea, sometimes some people vomit. Then if this peptic ulcer is left untreated, it can be complicated into internal bleeding, start bleeding internally, and can lead to perforation. So what are the treatments of peptic ulcer disease? Timely treatment of peptic ulcer is essential to prevent complications. Peptic ulcer disease is usually treated with medication and lifestyle modification, and the medication that is usually used for treatment of peptic ulcer include antibiotic. If it is caused by Helicobacter pylori, you use antibiotic to kill this bacteria. Then PPIs, that is proton pump inhibitors or histamine 2 blockers, are used to reduce acid production in the stomach and aid healing. Then antacid is also used to neutralize the already produced acid in the stomach and relieve pain. And also cytoprotective agents are used that support and protect the inner lining of the stomach from the acid. Now, the lifestyle modification include eat little meal at frequent interval. This food neutralizes the acid in the stomach and prevents irritation from empty stomach. Then you should avoid skipping meals. Don't skip meals. Don't eat late at night. Don't lie down immediately after eating. Then you should ensure that you eat food that are soothing to the stomach, like boiled rice, boiled potatoes, oatmeal, skinless beef, skinless chicken, low-fat milk or low-fat yogurt. All these are soothing to the stomach. Then you should also avoid irritants, anything that can irritate the stomach. This will aggravate the symptoms of peptic ulcer disease, like highly spicy food, peppery food, too hot food, acidic fruits like oranges, fried food like fried plantain, fried yam. Avoid them. Drink a lot of water, but avoid plenty water when you are eating. You can drink water after you have eaten. Then manage stress and ensure you rest very well. Maintain personal and environmental hygiene to prevent contamination. Stop the use of non-steroidal anti-inflammatory drugs. There are also natural and home remedies that can be used to treat peptic ulcer disease. These are just supportive treatments and not to substitute for the medical treatment. And the home remedy include use of honey. Honey is very good. It's healing. Then banana too. Banana neutralize, it has antacid effect and aids healing. Also, aloe vera juice can be used, but in small quantity. Add it inside water and drink it. Don't let it be too much, as this can cause irritation and diarrhea. This aloe vera juice has a soothing effect on the stomach. It promotes healing of the ulcer. Then it has some antibacterial effect, so it is very good to use. I also want to sound a note of warning here. Ensure you complete the full course of treatment to prevent reoccurrence of peptic ulcer disease, even when you feel relieved. And this brings us to the end of today's video. If you find this video informative, do well to subscribe to my channel, share with your friend, give a thumb up, and hit the notification bell below to be the first person to know anytime I upload another new video. See you in my next video.